Alrighty. Hello, thank you for joining us today. I am Kayla Bowen, Digital Marketing Specialist for Byram Healthcare. And today we are going to be discussing mental health and diabetes. At Byram, we know that life takes care, and this is one way we're fulfilling our purpose to have this discussion today. May is Mental Health Awareness Month, so we're going to be talking with Kristi and Anna, two experts in the field of mental health and diabetes. And before we jump into introductions, just a disclaimer that nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment, but is instead for information purposes only. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have about a medical condition or treatment before undertaking a new regimen. And never disregard professional medical advice or delay in seeking advice because of something we say here today. So, thank you so much for joining me today, Kristi and Anna. Let's start with Anna. Do you want to give us an introduction?
Sure. Thank you so much for having both of us. It's always such a pleasure to talk about mental health in a different format. I live with type 1 diabetes. I was diagnosed personally over 30 years ago, but I work at Integrated Diabetes Services as a sort of emotional health specialist, serving parents, specifically children, youth, young adults, helping them navigate the emotional burden of type 1 and really talk about some solution oriented opportunities for sort of shifting that mindset as we talk about diabetes in the future. So I live in the Boston area. I have two kids and have my own private practice called Finding Smiles Coaching on the side.
Fantastic. Thank you, Anna. And then Kristi?
Yeah. I am I've been in private practice for the last 3 years. Prior to that, I worked in the specialty area of diabetes and endocrinology in both pediatric and adult care for a little over 15 years. I'm also on staff with Diabetes Training Camp as a coach consultant, and I'm also affiliated with with Integrated Diabetes and Diabetes Training Camp, and I have my own coaching service that I provide through bravingdiabetes.com, where I work with people all over the country and all over the world with my passion for diabetes and mental health.
Fantastic. Thank you so much for joining us today. So let's jump into the conversation. First, we're going to start talking about the intersection of mental health and diabetes. So, Anna, would you like to get us started by discussing the link between diabetes and mental health?
Sure. I think this could be like a 4-hour conversation because we know that, diabetes involves hundreds of decisions a day, right? Like, should I eat this? How many carbohydrates are in this meal? The list goes on and on and on. And I think one of the easiest intersections to explain is that it's nonstop, right? Like, we don't ever get a break from diabetes, whether it is the caregiver, the child itself, the school caretaker. It involves constant supervision, like a toddler almost. So there's a lot of emotional guilt and shame and burnout and anxiety, and it's very natural that the statistics, or not surprising that the statistics of diabetes and depression and those comorbidities are very, very high, just from the sheer factor of all of the mental load that is expected for the patient to carry.
Right. Can you explore the bi-directional relationship of how diabetes affects mental health, and then maybe how mental health affects diabetes, Kristi?
Yeah, I would love to add to that. Yeah, I echo everything that Anna just discussed. And what we mean by bi-directional is that if and when, so we know like with depression that it's 2 to 3 times more likely with diabetes because of the burden that Anna was talking about. So depression makes diabetes more difficult to manage, right? Because of all of these 100+ decisions that we're making about, do I exercise? Do I exercise this much, that much? What am I eating? How much am I eating? How much medication do I take for that? Insulin, et cetera. So it makes the, depression makes diabetes harder to follow the intense regimen that it is. And then diabetes makes the likelihood for depression higher because you're living with this burden. And so the low motivation, the difficulty finding pleasure in things, the low mood, impact on our sleep, like a lot of the things that we see when we get screened for depression when we see our doctor, sometimes some of those symptoms can be depressed. So yeah, that's the bi-directional. I was going to get into a little bit about diabetes distress versus depression, but I think we're going to get into that later.
Mm-hmm.
Oh yeah. So that was where I wanted to go next, talking about the common mental health issues in diabetes. So we just talked a lot about depression, but I know that there's also some other mental health issues associated. So Anna, did you want to talk a bit about that?
Sure. And I think to sort of lead off with what Kristi was talking about with diabetes distress is that there is a huge difference between, signs of diabetes distress and, clinical depressive symptoms, and they are very different. And just because you have a diagnosis of diabetes does not mean you will develop depression. It's just sort of a red flag to be aware of, given all of these underlying semi-invisible tasks that really are kind of hard to master all day, every day. So when we talk about diabetes distress, what we're really talking about is burnout. We're talking about, I am so burnt out and overwhelmed, and my reduction of motivation is there, and it's starting to surface. And over again, if these demands are not met with support and acknowledgement, then it can lead to diabetes distress, which can over time lead to these clinical depressive symptoms like being extremely unmotivated to bolus, prick a finger, change a Lancet. And over time, there are specific clinical criteria for a diagnosis of depression. But most of the time, if we can master the symptoms of diabetes distress and get ahead of it, it may or may not be the causal, the cause for overall depression, if that makes sense. And maybe Kristi can elaborate on that. But diabetes distress is very, very common. At one point, most people experience burnout. It's like the length of time, the severity, and that actual clinical diagnostic criteria that has to equal a formal diagnosis for something like anxiety or depression. And Kristi can continue to highlight some of those things.
Yeah, I would say that things to be on the lookout for, just like Anna was talking about, is that what happens. So feeling burnout is normal. It's a part of the grind of diabetes, of feeling like you're constantly watching and monitoring all these things. And often what happens, because we're trying to be a pancreas, which is an extraordinary job, is that we don't feel like we're doing a perfect job with it. And we're going to talk more about the struggles with perfection that often come up. But what happens with diabetes distress and burnout is that we start to see, if not caught and not talked about, that A1Cs start to go up, time in range starts to go down because of the self-care lethargy that starts to happen. Like it just becomes too burdensome and we're tired of feeling like we're always failing, or we just can't get it right because blood sugars fluctuate. So that would be one of the things that I would add to that conversation about diabetes burnout and symptoms and what to look out for. So one, to normalize it, and two, this is what it looks like oftentimes clinically, and that there is help. There's an actual screening tool for diabetes distress that can be really helpful to kind of put it into subcategories of like, is it physician related? Is it, the fear of complications, feeling like you're failing all the time, like feeling friends and family don't get it, just to list a few of the screening tool questions that can help. When I've done a screen for diabetes distress, my clients have been like, wow, this was so helpful. This was so validating, because just like Anna was talking about, so much of living with diabetes is invisible. And all of a sudden we screen and they're like, oh, so you mean this is normal?
Right. That makes sense. So how about we jump into coping mechanisms and emotional well-being on that note of the screening? Either Anna or Kristi, if you
Yeah, I
want
can
to
jump in this
continue.
time. And yeah, the thing that I would say about diabetes, and this is easier said than done, but diabetes and mental health is, we have to learn and find the people in our support system to help us practice grace for ourselves. So the job of being a pancreas is, or the job of trying to change all these lifestyle, to make all these lifestyle modifications, type 1, type 2 diabetes, like it's a huge job. And so we need grace. A lot of what I see people struggle with is perfectionism. And that's just an unachievable goal. And so it's one thing to work hard and to strive for something, but it's another thing to expect perfection for yourself. So I would definitely caution around perfectionism, and work and activate your support system to help cultivate grace. There's so much more I could say, but I'll pause there and give Anna a chance to.
I mean, there's so much more I can say too about that. I think we're very lucky now to have access to technology and tools that are helping us meet our body from a physical standpoint, where the best sort of time and range of blood sugar and reduction of fluctuations can be. And I say that with capital letters, A-N-D, sometimes this obsession of keeping these blood sugars in sort of normal, I don't even love using that word, but very tight ranges can be detrimental to people's mental health. So the number one sort of coping mechanism that I make sure I do with really anyone, and myself included, is find other people who are going through a similar journey, whether it is online support, whether it is in-person meetups or events or camps or whatnot. It makes a world of difference. And I'm not talking about looking at everyone's graphs and comparing numbers, but the opportunity to connect and troubleshoot on specific scenarios is incredibly validating. That, number one, helps to prevent the burnout piece, but two, really recognizes your own strengths and sort of may highlight where you can have some self-improvement.
Right, absolutely. I'm sure that community is so beneficial in managing mental health along with diabetes. So, yeah, both online and in real life options. I'm sure there are a lot, right?
There's been so many people that I have met with, and I'm sure Anna would say the same, that I have a client right now that has lived with type 1 for 50 plus years, and she's never known anybody in her journey with type 1. And to Anna's point, it's so powerful to build up that community of people so that on a difficult day you can say, oh, my friend, like my pump site failed or my blood sugar, I don't know why my blood sugars, or I just had to do this really like courageous thing and saw my blood sugars go a little bit wacky because of that. Like, it's so helpful to have people in your corner that can see you, that to help you also take your focus off of the data and the biofeedback that we get from these amazing but also imperfect tools, to realize that we are more than data points, and that it is not the sum of us. It is not our sole identity. It's a task that we've been burdened with to function like a pancreas, but we wear a lot of other hats in our life.
Yeah.
Right.
Yeah, I could not agree more. I feel like, again, I'm going to highlight the technology is great, but where I see people struggle the most is where they have so much overwhelm because of this access to data that it's forcing them to have this like cyclical conversation in their head about all these what ifs type scenarios. And so having the support even with others who are processing the same type of information over and over again is so invaluable at whatever age and stage you're at with diabetes.
In my
Right.
personal experience with diabetes, there's been times that I would like an example I'll give from my own life is I had a pump site fail at work, and I had a very busy clinic, and I was starting to feel the ketones. I was feeling a little bit nauseous, and I was aware of kind of, I put my devices away so that I can focus professionally and have that level of professionalism. And then when I had the chance to look, and then I was like, okay, so I gave myself an injection. I changed my pump site out. I was hydrating, doing everything I could to manage it, and didn't skip a beat with finishing out my clinic, which that's just a personal value of mine, of trying to not let diabetes interrupt too much my professional obligations. But it was important to me to let people in my support system to know the extraordinary thing that I did that day, which was to manage a very difficult situation and not be well, and yet to get my wheels back under me. And so there's few people that could see that, and that's how I used my support system. People that live with diabetes and some of my dear friends that don't, that they were like, that's incredible. And I'm like, right, I know.
Right.
Yeah. I think, and that's sort of a huge, like, great example, Kristi, about the resilience and the strength that it takes to manage it. I mean, I have the same personal thought process. My pump ran out of insulin a few weeks ago in the middle of the night, and I'm just like, you know what? Sleep matters more. And I knew I was going to wake up with potentially ketones and feeling lousy. And I wasn't as high as I anticipated, but I knew if I had gotten up, gotten all of my supplies out, my husband would have woken up. And that balance and sort of moralistic thinking about if this, then that weighs on you. So the processing of just the decision, should I do this or should I do that? And all the repercussions that accompany those thoughts are, we become incredible humans because we are able to think about the world in a very holistic manner and serving ourselves and balancing the service of others. Which is very hard, but diabetes sort of forces you to have to make very brief, large decisions in that regard.
I could not, yes. And I love what you're talking about because it is so invisible most of the time. And yet it is extraordinary what we're doing. I had a situation last week that I was attending a conference across the state. I'm in Michigan, and the conference was 2.5 hours away. And we got a hotel, a colleague friend of mine, about 45 minutes away. So we did most of the trek, and I had a really busy day leading up to that. And I thought I threw an extra pump site change. And when we got to the hotel Monday night at like 9 o'clock, checked in, I realized that I did not have a replacement. I had my short acting insulin. And so I had to activate a support system to figure out like, okay, so how do I use this short,
Mhm.
short acting insulin? And so what I figured out is that at 4 a.m. I needed to start giving 1 unit every 2 hours until I got home the following day, or, later that evening. That was, and I was attending a drug conference,
Yeah.
but the friend that was with me was watching my calm, as I was managing this storm, this emergency,
Mhm.
and understood like what I like, and she was compassionate about the burden that would be every 2 hours to keep track of that. And then witnessed as I sat at that table in a room of 200 that I was giving little micro doses. But I could have beat myself up. Like, what did I do wrong? But like, it was grace, and it was a great opportunity for me to like execute this plan, this emergency plan. But it's meaningful to have people that know and see that was phenomenal.
Yeah, that's
Yeah.
huge.
Life happens.
Yeah.
Right.
You don't fill your insulin cartridge, you leave a pot, like
Yeah.
we are
It's like
more
leaving
than
the stove on the pod or forgetting to lock your doors. It's like it's a little bit more of a needs-based situation. And we also, to your point, have to give ourselves grace for, it's like a chore. It's just another chore.
Mhm.
Yeah. So on that note, with the discussion of the people around you, seeing and validating how hard it can be, and also how you're killing it through these difficult situations. Could we talk a bit about the importance of building a support system, how to go about doing that, both with other people with diabetes and then people in your life who don't have diabetes? Anna, do you
Sure.
want to take that?
I mean, I think the example that Kristi just shared about activating that support system. I think the hard part about diabetes is that, where do you start? When someone asks you, "Oh, what is it like to live with diabetes?" You're kind of just like, "Well, what's it like to be a mom?" You just have to like follow them around for a day. And in Kristi's sake, with her example, this is what happened. This is what I need to do to sort of like maintain where I need to be until we get home. And I think it's really about utilizing these teachable moments when you're in these moments of not necessarily distress, but you're at a restaurant and you need to think about what you're going to dose and what those after impacts are going to be. Are you going to walk home? Are you going to take the train home? All of these little decisions, a lot of times we don't share. And I think the more that we can share some of this sort of like internal monologue can help really our, outside the diabetes circle better understand some of that mental burden that we face. And I am someone that needs to start doing that more too. And it's impossible to keep up with the mental load of a person living with diabetes in their brain, because we are doing, like someone said, the most impossible job of trying to maintain the role of like a brain and a pancreas. It's just not natural. But from a diabetes community circle perspective, I mean, there are a plethora of resources. I mean, I was diagnosed in the late 80s and it was very few and far between. You really had to seek them out. Nobody physically wore diabetes on their sleeve. And now I wear my CGM proudly on my arm. I mean, there was no way of visibly knowing that somebody lived with diabetes. And now I walk through an airport and I see 3 people wearing a sensor. And even that is just like a visual reminder of I'm not alone. And that's a very subtle one. But making sure that you are surrounding yourself with people, sign up for that JDRF webinar, like participate in the ride. I think a lot of people are hesitant to share their story. And then there are some people in the bank of, let me scream it to the top of the world. And I think you just have to figure out what you're comfortable with and what your sort of values are when it comes to sharing and what that benefit might look like.
Mm.
Yeah, I would add to that and say, I think it's about being intentional that um, you think about like what are the different categories. So like as an example, if I go out to my car tonight this afternoon and I have a flat tire, like I know that I'm going to need somebody else to step into that support system for me. That so I think about it like that there's like tangible, there's emotional, there's motivational people. Like think about the people that you meet and begin collecting them, so that you've got a little bit of a robust, so that we don't have like just one person that we're looking to meet all of those needs. And I love Anna's example about sharing more, peeling back the drapes of like what is happening in our mind with these hundreds of decisions and scenarios and dilemmas that we're in, at a restaurant or running errands or in our workday or in our like life throws so much at us. And then there's diabetes doesn't take a break, right? It doesn't say, you know what, you've got a lot going on, I'm just going to hang out back here. It's like it's like biting at our heels, always needing our attention. And so it can be helpful to share, to reduce to increase our support and to tell the narrative of what diabetes really looks like.
So, how about self-care and emotional well-being? Do you have any insight or advice to share regarding the importance of self-care routines? Kristi?
Yeah. The things that I think about with self-care routines, one I'll always talk about grace. And I would say, um so there's the pillars that I think of as like sleep, nutrition, like how we're fueling our bodies, the emotional support, so sleep, nutrition, exercise, like just the four pillars of our well-being are the foundation. And then beyond that, we can get into like the nuances of the inner dialogue that we have with ourselves. Most of the time we have sort of a negative bias that we are harder on ourselves. We sort of got this inner critic. And I would say that try to get into more of a wise, compassionate mind when you acknowledge like the stressful situations, as you think about yourself. That would definitely help with a coping strategy that I often talk about in my practice.
Anna, do you have anything to share?
Yeah, I mean, I think when it comes to self-care, again, you have to think about what fills your cup. A little bit obviously beyond we think about those, daily needs like exercise and sunlight, I would add too, because we know with people with diabetes tend to have a lower level of vitamin D. But I think for a lot of people, when they think of self-care, think of like going to get a manicure or going for a run, and figure out what you value, what your strengths are, what fills your mental cup, whether it is a walk with a friend. It doesn't have to be like meditation or, you know, getting a massage or soaking in a tub. And if some of those things are helpful for you, capitalize on what works for you and really think about what lights you up regardless of what it is, because we were all human before we received this diabetes diagnosis. And it's my one of my biggest mantras is like, life goals matter more. Diabetes is always going to be sort of this leash, and I love that analogy, sort of picking away at those drapes, Kristi. But I think making sure that you are prioritizing you, how does this fit into my role as a human, and does it fill my mental cup?
I love that. I love that analogy of the leash, Anna. That's such a great metaphor. The other things that I would add to that conversation too is what often happens where we get into distress is that we're either ruminating on the past or we're too far into the
Mhm.
future. And so it's so powerful, right, for us to just really come right back to like the moment that we're actually in, breathe, right? We know the power of like just oxygenating our bodies, like that has that relaxation effect. And there's, you can look at box breathing, triangle breathing, like there's all kinds of little things out there. But so there's like really sort of like kind of strategy, technical things, but then absolutely what Anna's talking about of just like remembering like what fills your cup and really dial in those things. Yes, absolutely, to the sunshine, like go outside, be outdoors. That has a beautiful effect on making contact with the present moment, that we're just inundated with our senses, the sights, the sounds, the smells, can be really grounding.
So, how about we start talking about some practical tips and coping strategies? So, daily management challenges, and then how to cope with diabetes related stressors like medication adherence, lifestyle changes, etc. Anna, do you want to take that?
Sure. I mean, I think there's a whole myriad of strategies, sort of depending on what your insulin regimen is and what your habits are. And I think the most important thing here when we're talking about shifting habits or any type of behavior change is really just writing down what your goals are and really having that be the focus, and understanding that it is a process, whether it is like adhering to taking oral meds or shifting your mindset around a habit. Right now my personal sort of mindset shift is like not to change my pump site right before bed. I tend to shower at night, so I like to change my site right before bed. And I know that's like generally not the best idea, knowing that if anything were to go wrong, it's impacting my sleep, which
Mm.
is self care. So I think, there's so many steps to this process, but I think first and foremost is like, what's your end goal? And going back to the why, why do I feel like this is important? And is it important enough to me to make a change? And it has to really come from that intrinsic motivation in order to happen. And obviously you have the support and help from others around you, but first and foremost it has to be acknowledging that this is something you want and willing to work on. And then you activate your endo team, your partner, your whole household to sort of these steps and reminders and other like sort of emotional coping mechanisms to help you either remember or stay on task or whatever the sort of desired result might look like.
Yeah, I would I would add to that too that again we could talk about any of these topics for hours. But um that thinking about like any small movement. So to piggyback what Anna was talking about writing the goal down to get really focused on what is the end goal, and then how do you know that that's the direction that you're moving in. And then I would really, this is a little bit of a clinical strategy, but to build in affirmations for yourself. So set small goals. So like, what's the big goal? Is it to like decrease, increase, blood sugar averages? And then, so what does then that look like? Are you moving your body more? Are you changing the timing of your insulin, sort of pre-bolusing? Are you trying to be more disciplined about not missing insulin? Like, what is that? And then when you think about prompts in your environment, make sure that you give yourself lots of little attagirls, attaboy, like give yourself that
Mhm.
little bit of
Mm.
confirmation that like you did something that
Yeah.
that was kind of hard to do, even as small as it is, just to
Yeah.
add in that you're making a stronger feedback loop and a neural pathway in your brain when you give yourself an affirmation for that.
Yeah.
Makes
Yeah.
it
Mm.
stronger.
The little victories along the way and celebrating those little victories is like one step closer to something.
Mm.
Because it is a change from the week before. It might not be a significant change. You know, it's like, oh, my goal might be I want to get my time in range up to 80%, and right now it's at 70%. Okay, well, if you look at your 7-day average on a CGM graph and it's at 71%, hey, that's going in the right direction. If you don't celebrate that at all, how is that motivation to keep going?
Mm.
It's really about maintenance relationship with yourself. And a lot of that is positive mental attitude and self-affirmation. And it takes a lot of effort to share what some people may not understand. And I think that is the
Mm.
hardest part with personally living with diabetes is that, you know, the burden of explanation and self-advocacy never, ever, ever goes away.
Mhm.
Ever. And we're always meeting new people. We're always trying to cope with a new challenge. And that burden, that invisible burden, is always leashing on, for sure.
And to add to that too, it's normal that we're zooming in on the data points and the numbers and the percentages. Um, Exercise like zooming out as well. Put your life in context of the bigger
Mhm.
picture. Like we wear so many other hats than just a blood sugar percentage or data point. And it's normal that we're looking at that. Those numbers matter, right? Like, but we know that like the standards are set, like 70% time in range is the safe zone to be in by the American Diabetes Association, and 7% for A1C. And we know that anything greater than that 70% time in range is, can be really beneficial. But sometimes we can get really in the weeds with like how high time in range can we shoot
Yeah.
for, like
Yeah.
99, 100%, or A1C, I call it the limbo, like how low can I go? And we lose perspective of going back to what Anna was talking about when we first started our conversation today, like that there is a mental health cost. And so it's that zooming in and zooming out. Like the numbers matter to a point, but
Mm.
keep it in the context of all the other hard stuff that we have coming at us every day.
I love that, Kristi. I think I use this sort of phrase, I use this phrase with a lot of my clients, and it's just like pause and prioritize. You know, take one deep breath, like, how urgent is this? And there's this other phrase like urgent versus emergent, like in the grand scheme of things, let's take that 40,000-foot view. This is one point of hundreds on this line graph of the day. How much effort and time and energy do you want to spend fixating on this? And is this impacting your quality of life to the point where it's all day, every day? And that's where we loop back to that diabetes distress piece and that kind of rumination of the here and now, that can lead down the road of, a troubled mind. But making sure that we have some of those positive self-care practices and coupled with support, I would say, most people are able to maintain a level of balance to keep them focused and out
Mhm.
of, severe depression.
I think the other thing to touch on, like the stigma part, that like if our internal dialogue is so hypercritical, that's also the message that we're sending to other people about ourselves, about diabetes. And so it's really important that to help reduce the stigma, to peel back the drapes, to talk about the leash that we have with diabetes, is to also talk about like to talk about our diabetes and talk about ourselves with more grace, that it is really challenging job, but we want to reduce stigma. So a lot of times what I do is I share my lived experiences with diabetes. Um, I also keep it in some context so that I'm educating people. Not that it's always my job to educate and inform, like, because that's a burden that I don't always have to take on. But it can be really helpful to know that as I put it in perspective with yeah, it can help reduce the stigma. I got a little bit lost in my thoughts there, but I think reducing that stigma that like it's really a big challenge and it's about like failing forward or growth versus like a growth mindset, right? Instead of it being like a moral determination of who I am as a person based upon any data point, because this is the long game, right? Like diabetes is lifelong. So Anna's lived with this for over 30. I've lived with it for over 24. Like it's without a day off, right? Like it's a huge job.
Yeah, expanding a bit on the stigma surrounding diabetes and the impact that has on your mental health and well-being. Anna, could you talk a bit about that?
Sure. I mean, I think stigma is a very broad term. There is, and it's really how it is perceived. If you feel like it's perceived that you experience some type of stigma or some type of statement that you listen to and you're processing that as harmful or how perceived as a threat to you, or the sort of like group societally that you represent, like diabetes, that can be very hard. It can be very triggering. A lot of people um, like to label things and they like to assume things. And even 20 years ago when I went on my first insulin pump, someone was just like, oh, nice pager. And it's not it's little things. It's very, very little things and subtle things. And I don't even know if necessarily a lot of people would say that would be stigma, but it's assumptions and it's pointing fingers. And I really encourage people to just ask questions. Just ask. Pretend that you are not in the driver's seat. If you're curious, just ask instead of keeping those like presumptuous like thoughts to yourself, because you never know what someone's story is. And so I think everyone with diabetes is going to experience some form of stigma in their life, whether they realize that or not. And again, it is how we process that through activation of our support systems, sharing our feelings, whether it is through like individual therapy or through a text message to a friend or sharing that out. The more we keep our feelings and thoughts in, the harder it is to sort of over and over again process the years and years and years of whether it's stigma or labeling or the feelings of that like internal dialogue that we've been holding in for so long.
Yeah, one of the things that I think about is that when I was first diagnosed, I thought, well, I didn't know what diabetes really was, and I thought that I mean, it's not a super rare thing. And so what I came to understand is that people don't know anything about what diabetes really is. And so like, so I think that's part of the stigma that we experience, whether that is conscious or unconscious, stigma, is that people really they know the word diabetes but they have no idea about all of the layers that come with that. And so that feeling of aloneness with it, feeling that this is just me and part of the support system and just all the layers that we've been talking about with depression and burnout. It's all connected, right? We have this internal pressure that we put on ourselves, but there's also a significant amount of external pressure that
Mm.
we don't get mirrored back to us the validation of how much we're actually how burdensome diabetes is and how nuanced and complicated it is. And so even well-meaning friends, family, healthcare professionals can sometimes do things that increase feelings of isolation and stigma and feeling like you're failing. And it is what diabetes is. And not that there's not, some maybe different strategies, but I think it's more of the emotional impact of it is people just think they know when they don't know.
Mm-hmm.
What can loved ones or people in your life do to make you feel supported in your experience with diabetes?
I can,
Kristi?
yeah, I can lead with that. What I encourage my client in my practice, what I encourage people to do is to think about what I would say to the person living with diabetes is to think about first what you're feeling, identify what those feelings are, and then ask for what you need. So sometimes that's an internal dialogue alone that you are, okay, I'm mad, or I'm frustrated, or I'm tired, or I'm having grumpy thought. Like, what am I actually feeling? Oh, I feel sad, or I feel discouraged. So then now I know, so what is it that I need? Do I need to go for a walk with a friend? Do I need to go outside? Do I need to take some deep breaths? Do I need to distract myself in some way? Do I need to get some exercise? Like, so identifying what you feel and asking for what you need is what is to yourself first is going to inform you of how to activate your support system. And I would communicate those feelings. Like, I'm feeling really depleted today, or I'm feeling discouraged. Like, I just need a listening ear, or I need some exercise, or I need some company, or I need some alone, like, or I need somebody to grab a meal or make a meal. Like, that would be, I think, the most helpful thing, is to begin to communicate from a feelings perspective. That's going to speed the connection.
Yeah, I would agree. I think I personally just like, I have a hard time sharing about diabetes to non-diabetes understanding friends and family, and those who are sort of on the outside of having it in their home. Even friends I've known for decades, unless you live it very, very close to your home or in your home, it's really hard to grasp all that internal dialogue and processing. So I try to talk sort of similar thing, talk to myself. Okay, what is it that I'm actually feeling? What is it feeling? What am I feeling? And I don't try to justify the why, because like there's no point in doing that. You have to kind of just own it and label it. And a lot of the times what I do is like write it down. If I'm not in a place to write it down, I share, I'm having a hard time right now. Even if you don't want to invite people in to talk about diabetes, just like, I need a minute. I'm having a hard time. I need some processing time. I also very much encourage people to ask questions. I don't like to bring it up because I don't want to be a burden, but I always want people to ask. I always am willing to share, and I always want people to ask. And so I think if you're meeting somebody for the first time, one sort of acknowledgement or validation you can say back is like, thanks so much for asking. I really appreciate it. Leave it there. And I think that goes a long way, because it makes you feel like you're in the driver's seat. You're always the team captain when it comes to diabetes. You're everyone else outside your mind and your body. They're your supporters. They're the co-pilots. They're the people there supporting you and what you need. But you also have every right to say, no, I don't want to answer that question right now. And I do this activity a lot with kids too. It's like, you have the power to be like, I don't want to talk about, if a kid says, I don't want to talk about diabetes today, you have to respect that boundary. Maybe they're just not feeling it. And I think that is very, very powerful as we teach kids to listen to their bodies and teach adults to listen to their bodies too, to really just recognize what is going on internally.
One of the things to add to that too that I find really helpful and a rare skill set is as you ask somebody about their diabetes, also in your empathy, think about like validate the emotion, like, wow, that you do that so so
Seamlessly.
seamlessly.
Yeah.
Yeah, thank you. That like, or I'm amazed at how calm you stay when or I can't even imagine having to make those decisions at a meal. Tell me more about that. But like the think about the emotion and validate that for someone that's going to be like a real cherry on top of helping somebody feel seen and safe to share more as well.
Mhm. So we don't have any questions in the chat, but would you both like to offer some closing remarks, insight, advice to wrap up our amazing discussion today? Anna, would you like to start?
Sure. I guess my number one tip and advice sort of just is a one-off statement of what Kristi was sharing further is just acknowledge your own feelings before you share them out. I think it's really important to just pause, prioritize, think about what is really, really important in the here and now before you either accuse or assume or take action in the moment. I think a lot of us can get caught up in, I need to treat this blood sugar right away or else. And we, get straight to the long term. Diabetes is never going to stop impacting our mind. And the more that we can, bring self-awareness and have awareness to the present, the more we can sort of stay centered in the day-to-day and that sort of long-term approach to managing our overall sense of well-being.
Thank you.
Ooh,
How about you, Kristi?
final tip. I would say don't be afraid to make mistakes. Give yourself grace. And know that if you are really struggling with that, reach out for help. You're not alone. And it's very common with diabetes that it's really hard to get untangled from those weeds in our mind about what a blood sugar and how we're supposed to do everything. But it just doesn't help. And so if you need help, if you need more support, do that. There's a couple of websites that I often recommend if you're looking. I know that Anna's got her website. I've got mine. There's national teams that you can get connected with, like Integrated Diabetes Services. There's Diabetes Training Camp is another great resource for finding people with type 1. And then but there's the American Diabetes Association Mental Health Provider Directory as well that has a list of licensed mental health professionals that also have additional training in diabetes. And then there's a host, and maybe Anna knows of other ones. But if you're struggling, just know that help is available. And don't be afraid to reach out, whether that's in your support system and really activating that, or being intentional about building that up, or if it's seeking professional help to get that right coach, professional person in your corner.
Yeah. And I think the only last sort of thing I would say for that is like, no social worker or therapist wants to see a client or a patient in crisis. Yes, we are here for that if that arises, but we would much rather you reach out to us saying, this is what I'm feeling. Can you help? rather than wait to the point of like potential no return. Because, and then that's a very extreme statement, but we want to help you get to where you want to be before it gets to that sort of tipping point. And that's why we're both in this for the long haul from our career, passion perspective. I work primarily with families, youth, young adults. If you go to the JDRF website, ADA website, there's children with diabetes there. You go to the Google machine and you can't go wrong, from podcasts to books to audiobooks to, there's so much out there in the world. I caution you to, take everything if it's too overwhelming from that online support standpoint. But from an individual group perspective, there are plenty of options.
Well, you both are incredible. Thank you so much for joining us today. Your insights and advice have been so valuable to our viewers, and it's been such a pleasure to talk with both of you today. I just need to state again that nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment, but is instead for information purposes only. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have about a medical condition or treatment before undertaking a new regimen, and never disregard professional medical advice or delay in seeking advice because of something said here today. So thank you both again for joining us. For anybody watching, please follow us on Instagram at Byram Diabetes Care. We will be hosting monthly live streams with experts in the diabetes space every month going forward, as well as providing other useful information in other formats. So we look forward to seeing you again, and thank you both again for joining. Have a great day.
Thanks. Bye.
Bye.